My name is Dr. Fackrell, and tonight I'm talking about belly pain. So this is Sam, and he is going to be my model tonight. So today, a lot of times we get patients in here with belly pain. And the question is it safe or unsafe? And so we're going to talk about some of the things that we worry about with that. A lot of times with kids we'll have belly pain, and the big thing that we always worry about is appendicitis or a bowel obstruction. So when we're looking at a belly, the areas, first of all, that we see issues with, if there's pain up in this area here, we start to worry about gallbladder disease, possible liver issues. If there's pain on this side, this is where the spleen is, especially if it's been after a trauma, we wonder about splenic issues. Pancreatitis right there in the middle. On this side here, usually lower and above is usually more of like a constipation, diverticulitis. On this side, we start to worry about the appendicitis. For kids especially, they'll start having pain right here, and it will radiate and start to be down here. So if we start having pain in some of those areas, it's important to have it looked at. If they have diarrhea with it, generally that's a better sign, because then the most common thing is a little gastroenteritis. If they have puking, that can go with appendicitis. Or the other thing we worry about is a bowel obstruction, and that's where there's almost like a kink in the bowel, and nothing can get past that. And that's something that we definitely worry about. In fact, in my residency, the saying was, never let the sun go down on a bowel obstruction, because if you do, people could potentially die from that. So those are things to watch out for. Again, if they have diarrhea, and that's usually a little bit of a better sign, but then of course you've got to watch out for dehydration. You want to make sure that they keep drinking. But if there's any belly pain that lasts for more than a couple of hours, that is moderate to severe, it's not a bad idea to have it looked at just to be safe. Thank you.